give a brief introduction on myself and Humphrey. Well, really Humphrey is going to show you his brainchild. And then during that, you will no doubt have some questions. What we're going to do is aim to break for questions at the end. We've got 45 minutes, or 40 minutes now, 39. And so we're going to try and talk for sort of a bit less than half an hour, because we really want to get your engagement and to help you to understand what we've done so far. Clearly, there'll be modifications to come in the coming months, but we think we've done the short-term modifications to launch. So I'm going to introduce why we are where we are. Many of you will know that NNAP has for years been publishing annual reports, and there are a few of the previous paper reports on the floor of my office. And this I have come to think of as data for assurance. We know that, for example, in Bradford, our antenatal steroid rate was this. And that data is kind of cleaned and assured. And when I allow the data to go, I'm very careful about what I allow to go forward in order to not misrepresent. So assurance, and this is what assurance looks like in the most recent year. So this is our annual report on 2022 data, and we're busy writing the one on 2023 data at the moment. But this is what appears in the public domain. It's a state of the nation report, and again, it's a sort of summary of where we're at for a year. But a reasonable criticism that people have always made of reports like this is that they're by the time you read them, the data is quite old. So we'll be publishing a report in October this year about 2023 data. There are some good reasons and some not so good reasons why that takes such a long time, but a very reasonable criticism, as I say, is that the data is necessarily old. So as part of our new contract with our providers, we've been requested to, and have delivered, a dashboard. They wanted publicly facing data. And hopefully all of you who've joined the call today are already familiar with this. Those of you who are double devicing could go and look at it on your other screen. So this is if you Google NNAP dashboard, you'll come up with this front page. And this down the left-hand side down here, I hope you can see my mouse moving, shows the 10 measures, which are some of which are composite measures. That form the output of the main output of NNAP, or the output of NNAP. So this is the front page of the dashboard, and I think the sexiest parts of the dashboard, well, it's really a time series document. So here, for example, we have from 2017 to the end of 2023, mortality in very preterm infants, 24 to 31 weeks inclusive. And the black dashed line shows the average mortality. You can see that I'm showing here a particularly neonatal network, very impressively London Northwest, but a successive decline in mortality. Most impressive. Hope there's somebody from London Northwest on the call. And broken down into different gestational age groups. There's a tiny bit of missing data here back in the day, a long time ago, for mortality, but very little missing data overall. That varies by the measures. Obviously, one can set this up by you can alter the fields, so you can look at your own network and indeed your own unit. This is live, it's there, and these are quarterly data points. You'll see these pink dots are the 4 most recent points. So this is another measure, a composite measure, and this is the proportion of babies who get all the perinatal optimization metrics that we measure. So the proportion of babies, you get them all. And here I'm showing Bradford data. This is in the public domain, so there's no not to betray anyone's confidence by showing this. And you can see that on this particular composite measure, Bradford are doing quite well. So if we were worried about our mortality, we might think, well, perhaps there's something we could do better. We could look at the parent. But again, you sort of look at this and you think, okay, well, this is all of the measures. But what about deferred cord clumping? What about temperature? What about early breast milk? So you might reasonably want to dig further into this. And we can't show that in the public domain because the numbers would be too small, even for a reasonable size centre like my own in Bradford. The numbers become too small. So here we go. This is what we call this the PAD, the public access dashboard. And note the change in colour as I scroll the slides. a different thing, the RAD. And I think this is truly rad. This is what we're here to discuss today. So Humphrey's going to take us through the restricted access dashboard. But it's broadly that I'm taking you to the time series first of all, the same sort of format. Here I'm showing you the deferred cord clamping. I mentioned missing data before. Lots of missing data for deferred cord clamping in the early years. This is my own centre, and not particularly surprising. But you can see in the blacked dashed line, the national average, this is the overall national average for the whole population, much more deferred cord clamping going on in babies of less than 34 weeks over time. And my own centre doing okay at that. The middle grey bit is the middle half of all units. And the light grey is 80% of units are in the light grey. And so one doesn't need to remember that. It's not statistical particularly. It's designed to show you where most people are at. There's a load of clever stuff that Humphrey can do with it. And because he's a brave person, he's going to do that without using slides, but using the actual tool, which is now live, Humphrey? Not quite.
We're adding the last users, and it should go live this afternoon or tomorrow morning, very early.
Okay, fantastic. Anyway, take it away, Humphrey. So I'm going to get off, which involves me stopping sharing, and Humphrey's going to take it away and give us a guide, and then we're going to do a joint questions once Humphrey's finished. Fantastic.
Right. Can we see this, Sam?
I can see the slides. I can see the information front page.
Fantastic. So my name is Humphrey Legg. I am the NNAP data analyst. I've been working on this with the team over the past few months, and I'm just going to go through it now and explain the features and the ways it maybe differs from the publicly available dashboard. Starting on the information page, the information contained here is much the same. Obviously, it relates specifically to this dashboard, so it's a little bit different. The tabs for the different types of information available are down here. On the public access dashboard, you'll see that these are the measures. But here we have different types of tables and charts and different displays of information that I'll go through. So the menu is a little different to what you might be used to. The external link buttons are the same, with the exception of this new one that we've added, and this will also be added to the public access dashboard. And this is a button that will take you between the two. So assuming you have access to the restricted access dashboard, you should be able to use this button to get back and forth between the public and the restricted access dashboards. The last thing to mention is the card in the bottom corner here, and that tells users when the dashboard was last updated. And that can be very important to know when you're cleaning data, exactly how up to date the data contained in the dashboard is. So if we move on to the FAQ page, the format is obviously the same here. We would only ask that and we would love to hear queries and questions from people about the dashboard, if you could check the FAQ first to make sure that it's not already been answered. If it's not there and you email us, we'll be keeping records of those. And if we get many records of the same type, obviously they can be added to the FAQ. So we're expecting this to grow in length the longer the dashboard's available. If we go to the time series data, this we've already seen from Sam, so it will look familiar. The format is very similar to the publicly available dashboard, but there are some important differences. Firstly, the data contained in each of the data points relates only to the quarter itself. For the public access dashboard, each point is a rolling 12-month average, and this is just a quarterly average contained in these periods. As Sam's already explained, the blue line is the proportion adhering to the measure listed here. So in this case, it's deferred cord clamping, and for the specific unit. The black line is the national average over time. And the grey bars the dark grey represents the middle 50% of units, and the light grey, the middle 80. So if you can see here where one of the points rises above the light grey bar, you could say that for this quarter, for this measure, for this unit, that result is in the top 10% of units. And if it was obviously below, it would be in the bottom 10%. We can also adjust the slider scale here. So if we wanted to remove, for example, the unassured data points, so the most recent, we could pull it back a little bit and that would disappear. And then you can also select more recent periods by pulling the slider and they will all adjust. For some measures, it's helpful to scale the y-axis. If we look at parental consultation, for example, we'll see that the line here is very much at the top of the screen. If you scale it, it will, the y-axis will adjust, so it's a more appropriate scale. We've also added additional lines here. So there is a line that will show the average for units of the same type, which is listed down here. So here the green line is the NICU average. We can also add the ICS line, which is again listed down here, the network line. And all of these cards down here will update based on the unit that you have selected. With all those lines on, it can get busy, so you can also hover over the chart key and that will give you information about what the lines refer to. So this you will have kind of seen before, at least in the public dashboard, but we also now have table data available. And this offers the numerators and denominators for the units result for any measure going back to 2017, and you can expand it. It's broken into quarters as well. So one request I think we will get for this type of data is, can it be downloaded? The answer is yes. It's a tiny bit fiddly, so I'll just take you through it now. But just so you know that this is also included in the FAQ, these details of how to do the download. But if you click on the more options, you'll get an export data option. If you click on that and you take summarized data and you go to CSV, then the export button will appear and that can be downloaded onto your local computer or whichever system you're using. That is also possible for the patient list, which we'll look at in a minute. But obviously, if you're downloading a patient list, just do be aware of whatever local processes you have about storing that information. Underneath the table data, we have a clustered bar chart as well, which is a way of showing how your unit is performing compared to against all metrics in one place. And you can remove these comparisons as well or add them. So if you just wanted to see your unit, how it compares to its ICS, that would be one way of doing it, or how it compares to the national average, for example. That's also possible, or any combination of these. Looking at the network data tab, for unit users, you probably won't find this tab very helpful because it will only have a row of information for your unit, which will make it very similar but not as good as the table data. But for a network user, it's obviously very important to be able to see all of their units in one place. And because there's no timescale down here, we have time periods on the side. And obviously you can select quarters as well if needed. These can also be sorted by compliance rate as well. And again, this can also be downloaded as well using more options. Moving on to the patient list, this is designed to replicate the patient lists that we share via the quarterly reports at the moment. So it should look very similar in that sense. There are a few ways we can envision people potentially using this. I think the first and most obvious is looking at data cleaning. So when data cleaning, previously you'd have had to go through each tab in the patient list and look for the missing records one by one, but now you can have all that in one place. So if we wanted to look at the 2023 missing data, for example, we just select 2023, and in the status, you can select the missing, and these will come up here. And obviously in the live version, it will have the episode ID, but I've removed that for presentational purposes. And you can also sort by the episode ID, so it would be possible to clean data by patient, whereas before you could only clean it by measure, by one. And obviously these can be filtered as well, so you can look for missing data in specific measures. Another way that you might want to use it is to follow through points from the time series to look at specifics for a given point. So if we take an example in the temperature measure, we can see there's a point down here which might be of interest. We can see it's 26.1 for this quarter for this unit. And we can follow that through into the table data. It was 2022 Q1. We can see that's the same percentage, and we can see here the numerator and denominator for it, which is a bit of context, but for a bit more, we can go to the patient list and see those exact patients. And if we take the temperature, all patients, and then it was Q1, then we can see that list of patients there, and possibly from this, from the details tab, you can see there's a pattern emerging, well, not pattern, but there is something to be said. It looks like a lot of hot babies there, and then some recorded late. So there's a way of taking those time series and following that information through to get to something that's a bit more tangible. This can also be downloaded as well, using the same process as before. The last page to look at is the user list, and this only contains data on the other users that have access to your unit's data. So I've removed the names here as well, but essentially when you're logged in, you see this page, you'll have a list of people with your unit and the names of those users there, and that will be the list of people that can also access your data. And the reason we've added this in is it allows teams to basically keep an eye on if anyone needs to be removed or if someone isn't there that should have access. And then there's details down here on the side that detail how to get that access added or removed. And that brings us to the end of this section. Sam, is there anything you wanted to add to that?
Only to say that I agree with Sarah's comment in the chat. But then I would say this, wouldn't I? But I think this is genius. And I think we might leave it up with you sharing your screen, because I'm hoping that some people will want to say in the chat, or we can they unmute themselves? Possibly not.
I don't think so. I think you probably need to.
Rob, have you managed to work out how to speak yet? I know you were having trouble using your microphone or getting heard.
Sorry, Sam, was Humphrey and myself were in the same room, so we're trying to do a double miking scenario.
Genius. Okay, so let's try and take some questions. Inevitably, I'm aware that you'll all have. Oh well, I can suggest a way to do this even better. But we're mostly here to answer questions and demonstrate and hopefully educate's a bit pompous, but show you how to make best use of what we've got currently. We are, of course, going to iterate and improve, but we're not going to do that in the next week or two. We want to get it up and out there. What questions and comments would people like to make? You can all send Humphrey chocolate as well if you like, but questions and comments. Would anyone like to ask about how to do something, how to see something? We can show you some Watson All Bradford data if you like. I've got no problem with that. So there was a question earlier on in the chat about, which I'm hoping I may, will there be an ability to add live users at a later date? So Anushma, I'm not sure whether you meant, will Anushma be allowed to add live users, or will we be able to add live users? Do you want to clarify that? Can we unmute Anushma, or is that impossible?
Don't think we can unmute. At least I don't know how to at the moment, I'm afraid.
Anushma, can you clarify that in the chat? So, and I think, as I think Humphrey said, but what I think what we've done is we've written to the clinical leads in all the networks saying, we're going to put you on, and we'll put your colleagues, perhaps your consultant colleagues or your lead nurse, whoever you want on, but you need to send us their email address, and it's got to have NHS in the root. We're not putting doctors' net email addresses in. It has to be an NHS email address, and then it will automatically recognize you. So no login, which is a key thing from my perspective. We needed to not have a login, so there is no login process, and you'll be able to move from the pad, the one I showed you, into the RAD, with just a sort of click on the relevant button. Humphrey says confidently, as though he remembers where the button is.
The only thing I would say about the login is that you will need to be logged into the Microsoft user account, which is added, which is the email address that we have. Most people are logged in by default, but if you're not, you would need to log in using that, but it should be the same as your email address.
So your clinical, if I haven't answered Anushma's question, if you will add more, if I needed you to, says Anushma, yes, we will, assuming you're the clinical lead. And if you're not, you've got to make friends with your clinical lead and get them to send the email.
Exactly.
Really good. Have you sent the login details for the RAD? You don't need a login. I think I'm correct to say, Humphrey, because you just got to, providing your email address is recognized by us and is loaded by us, then you'll be able to click in and out of this day and night, cleaning data every second of your shift.
Just to update on that, we emailed the clinical leads for updates on the user lists last week and this week. Those are still coming in now, which is why we haven't yet made the report live and shared it. But we're adding those users to a group at the moment, and once that's complete, that group will be given access in one go, and we'll send an email as soon as that happens.
Fantastic. And Kieran's got a question. How many weeks after a quarter period finishes, Humphrey, does the data point go online?
So at the moment, this version is quarterly. The next version that we release will be monthly, and that will happen next month, and that will happen at the end of the month. So it won't include June, but it will include May. Following that, we will release the next version in the middle of the month, I believe, the middle of July. So June will be included in that, and following that, we will move to a standardized release date, which will be the second working day of each month. So on the second working day of each month, we will have the full set of data for the prior month out, and at that point we won't be sending emails to people to remind them that it's been updated. We'll just be rolling those updates on a monthly basis.
So, Kieran, the answer to your question is how many weeks after the quarter period finishes? I'm not the world's most patient neonatologist, it has to be said, but by August, this will happen not weeks, but within a few days of the end of a calendar month, and it'll be calendar month rolling. And so you'll see lots of dots. Now, can you show the bloodstream infection data for Bradford? I told you to show warts and all. So our bloodstream infection data, as you're about to see, is not something for us to feel desperately, oh, can we have those scaled y-axis? Thank you. And if you could put the unit type line for NICs on too, please, that'd be great. So as you can see from our blue line, quarterly, our infection rate is way higher than the green dotted line where we would like it to be. We'd like it to be below that, preferably 0. But you can see it bounces up and down a fair amount. When that goes monthly in August, it's going to be even more jumping up and down, which is going to look funny. We are required to do this monthly. And so we've got, so that's how it's coming. And I hope that's an answer to Kieran's question. Sarah said, how many, she's got colleagues who would like to watch the webinar. She's going to sit them down in front of the screen and make them watch it. It will be recorded, but they'll be editing out all the bits from me. and that will be up and running in a few days. So we'll aim to send out a link to NNAP contacts, which will hopefully include you, Sarah. There is no grace period to update the data, says Tristan. Shall I take that one, Humphrey, or do you want to take that one?
I can say, yeah, there won't be any grace period, but this report, it's important to remember, is restricted access, so it's not released. It will be only available to your own unit or the network that you're in.
So someone's put their thumbs up on that, and Kieran's asking a similar question. So I hope we successfully made the point, but if you look at what's currently showing the bloodstream infection data from Bradford, you can see that most of those dots they're dark blue, aren't they, Humphrey? But the right hand one most is dark pink. I'm moving my mouse over so you can all see it, which you can't. Is dark pink, thank you. And that is to indicate that that's unassured data, because it's the same graphical style as is in the pad, which is clearly publicly accessible. And so unassured data appears slightly differently to help you visually distinguish. But the point of this data is, as you say, is that the RAD is restricted access. It's inside your trust, and it's not published in that sense. Hopefully, Anushma, that answers your question of 1629. And we absolutely agree that people don't clean up their data regularly. Of course, we're extremely interested and engaged in trying to help people to clean their data as regularly as they want to. We won't be publishing data for assurance in any different way. We're still going to do the annual reports in the way that I showed you, and we still do, and make quality improvement recommendations and all that. But this is designed to assist quality improvement. So it's designed to give you close to real-time data feedback. And I need to scroll down my messages. Will be a 12-month rolling average line, says Tristan, to iron out the monthly variation.
Yeah,
the RAD.
Yeah, just to take that. So obviously in the public access dashboard that already exists. In the restricted access dashboard, yes, we will add that, because we anticipate when it moves to monthly, it probably won't be as easy to read. So we'll add that in for the monthly release.
Okay. So that's a key difference between the pad and the RAD, is the rolling averages. So the pad needs to be rolling averages, partly to maintain the confidentiality of your patients, because we don't want anyone working out something about patients, and we've very carefully risk assessed that, and we're confident that that's okay. But if we were to show, for example, the data that's in front of you at the moment, then that runs outside the NHS family, then that runs the risk of giving the identity of patients. So we're not okay with that. And if we might move back to, we'll move to a different measure. I'm not sure what. Let's move to, I don't know. Then move to network mortality, Humphrey. So
network mortality isn't in this version.
Oh,
of the
so
plot,
it isn't. I'm
because
just thinking of something.
Because it's units only, unit data only.
You've already shown the temperature stuff. Let's show that. Fantastic. So, Sarah, I'd like to ask. Might we come back to? Sarah wanted to ask units, how units can use the RAD to identify high or low performing units for particular metrics, to identify shared learning. Do you want to take that, Humphrey, or shall I?
Well, you go ahead, Sam. I'll chip in at the end if necessary.
Okay, I think you can't use the RAD to identify other units. The RAD is for your own consumption. So if you want to find somebody who's particularly good at deferred cord clumping, then you need to look at the data for assurance. So you can look at, if you wanted to find out how good Bradford was at deferred cord clumping in 2022, you can go on NNAP online and you'll find the data there. And similarly, other organisations, you can find out if you want to find someone who's good at infection, then you're not going to look at Bradford's data, but you can find that data in NNAP online. What you can't do is use the RAD to do that, because it runs the risk of identifying individual patients, and we can't be having that. Humphrey, what would you add to that?
Just that you could use the public access dashboard to find high performers, and that is updated more regularly. There isn't currently a way of searching across all of the units' performances at the same time at the moment, but that is something that we'd be interested in looking into.
Fantastic. So Kieran's asking, when is the public data charts, I think he means the PAD, updated? Yearly, he says?
That will also be updated on a monthly basis alongside the restricted access dashboard. However, each data point obviously contains a year's worth of data, not just 1 month or quarter, as is the case for the restricted access dashboard.
Okay, so unknown user asks, my question was more in keeping with the previous one. Will there be time to clean data efficiently before publishing? We're cleaning data regularly. Oh, it's scrolling up. But even so, if there's not time designated for cleaning, it's likely that some of it will be incorrect or incomplete the last day before the deadline, for example. Absolutely, we absolutely accept that. So the two mitigations that we think we've set in line for that is partly we're not publishing the data. And secondly, we're identifying the data that's not in a period that you've offered data assurance for, namely the last 4 quarters in the current quarterly or the last 12 monthly points. Humphrey, what would you add to that?
Yeah, just that it is in some senses published in the public access dashboard because it is included in that. However, as you said, it's marked as unassured data, it being a pink dot instead of a blue dot. So where that is released publicly, it's part of the whole year of rolling data, and also it's marked as unassured.
Fantastic. So if networks can see the unit data, says Sarah, would this be pulled at NHSE by any point? No, we don't think so, and we have confidence that our network colleagues won't use this data to send to NHSE, and we're confident that NHSE won't ask for it. So Julie Claire says, sorry, you've probably said, but how can I get on the RAS? She says. Oh, sorry, did you mean RAD, Julie Claire? So you can get on the RAD tonight, probably, and certainly by 8 o'clock tomorrow morning.
Yeah. The only thing I would say is that for Scottish units, there has been a delay due to an application we've made with them to share the data with the RAD. But for units in England, Wales, and the Isle of Man, it should be this afternoon or early tomorrow morning at the latest.
So basically, Julie Claire, you've got to get a job in England by tomorrow morning, and then you can get on the RAS. Yeah, unfortunately, we can't. We're only allowed to move Scotland when everybody in Scotland has signed up, and we're not there yet. I'm sorry about that. Very good. So would somebody working in improvement for a national organisation be able to access multiple units data? No. Short answer. Any other comments from Rob or Humphrey?
Yeah, I don't know. No would be the answer. If a network wants to add a user, we have named individuals in each network, and if they ask us to, we will add users for them. But obviously, they wouldn't be able to access any of the patient lists, the network users, but they would be able to see all of the units in their network.
Fantastic. So great questions. Anushma says, I'm sorry if I didn't hear it clearly. The pink dot on the pad will become assured daily on a quarterly basis. I'm sorry for my failure to explain that. I'll let Humphrey have a go explaining it, and then I'll come in if it's not helpful.
So for the annual report data, we have an annual deadline of the 1st of April to finish cleaning your data, so it's included in the annual report, and that we can be sure that it's as accurate or as close to accurate as it can be. So any date after that hasn't gone past the 1st of April in a year is listed as unassured. So when the 1st of April, any data that hasn't gone past that date, essentially. So any data recorded from the 1st of April onwards till the following 1st of April is unassured.
So the assurance process, Anushma, relates to the pad, really, because this is not published. but we will use the same visual convention in the RAD as in the PAD. And the data that hasn't been through an NNAP assurance window, which is what we've been calling it, as Humphrey says, which finishes on the 1st of April, is will feature as pink dots. Is it possible for you to view data for more than one unit? No, not in the RAD.
It is actually possible. If you work for 2 units, you can be added for both, and you can see both patient lists, and that goes for networks as well. So there are some network users that have 2 networks. They will be added to both. And my understanding of the functionality is that they should be able to see all of the units in those 2 networks.
Very, very helpful. Thank you. I was basically thinking of myself. Can I see my colleagues in Leeds data? Absolutely not. But if I worked for Leeds and Bradford, then of course that would be reasonable for me to look at Leeds and Bradford, wouldn't it? Very good. Okay, I think we've exhausted their ability to ask questions. Hopefully we've given reasonably clear answers to them. As ever, we would love you to email us at the NNAP email address, which you'll find on the website. And I think that's a great way to get hold of us. There's only one Sam Oddie. I'm relatively easy to find. I'll stick my email address in the chat, and in case anything I've said doesn't make sense. Where am I? So any other final comments from Humphrey or Robert?
No, all good from my side.
Nothing from me, Sam.
Great. Well, you've been a fabulous audience. Sorry for my teams dying at the beginning. We'll definitely edit that bit out. And we will look forward to interacting with you and helping you to get into that. If your clinical lead hasn't given you RAD access, then make friends with them and get them to email. They've had a couple of emails from us, and they can find our email address on the website. And there it appears in the chat. Very good. Thank you all. And it's a Zoom wave from the NNAP team.